Okay, in this video lesson, we're going to talk about, well, what can we do about neuropathy? And I want you to know you do have options. You're not limited to just the medications that we've talked about. So let's talk about, well, what can we really do? Well, one of the things you can do is nothing. You can choose to do nothing. And often, sometimes that's the approach that people take. They think it's not that bad, I can live with it. Uh, some people are in such a bad state that they literally sit in our clinic, in our center, in absolute tears because they're in so much suffering. But here's the thing to remember, wherever you are in terms of that spectrum, neuropathy is progressive. We've already talked about that. Also remember that there is complete and absolute hope in the fact that the National Institute of Health says we can regenerate nerves if the nerve cell is not dead. There is absolute hope and possibility. Now, one of the things you could do is you could go see your primary doctor, and many of you maybe already have. That's usually the first step that many people take. Here's the thing to understand in terms of traditional medicine and how traditional medicine has approached neuropathy. It's called the standard of care. Standard of care is the box within typical medication or typical traditional medicine and how they're going to approach this. Most likely, your primary doctor is going to do one of two things or both. Prescribe you some Neurontin or some Lyrica, say here's the prescription, and or refer you to the specialist. In this case, the specialist would be a neurologist. That's most likely, not always, but most likely what your primary care doctor is going to do, according to the standard of care. Now, if you do get that referral to the neurologist, what is the neurologist's standard of care? What are they going to do? Well, they may do some sensory testing, some very simple sensory testing, which is going to test different sensations to see, or identify if you possibly could have neuropathy. They may do some EMG testing. EMG testing is specific testing that is going to very clearly show if you do or do not have neuropathy. Here's one thing to know, though, about EMG testing. Most often, EMG testing is going to be done on large nerves. We talked a little bit about large nerves in one of the other video lessons. Large nerves, they'll do that testing on to identify, and if they do find neuropathy present, then they'll be able to tell you that, which is fantastic. Then you know. Here's the thing, though, is that when they do that testing on those large nerves, they don't do testing on the small nerves. They're going to make an assumption that if they find peripheral neuropathy in the large nerves, that there's also peripheral neuropathy in the small nerves, and that's a very, very good assumption. However, you could end up with a false negative in terms of if they don't find neuropathy in large nerves, you may have neuropathy in the small micronerves that they don't find because they don't find it present in the large nerves, and then you wouldn't necessarily know that you have neuropathy. So a little bit of a situation there just to be aware of in terms of that. No matter what they find, if they suspect or even diagnose with neuropathy, most likely what they're going to do is prescribe, again, either the Neurontin or the Lyrica. And they're also often going to say, there's really not much we can do about this. It's just something you're going to have to live with. Well, unfortunately, just living with it does not look very pleasant, because just living with it can mean a lot of different things and lead to a lot of different outcomes that maybe aren't very desirable and not something we necessarily want to deal with. Now, doing the same thing over and over again and expecting different results, what's that the definition of? You are correct. That is the definition of insanity. Who defined this? Who is it that said that? A very smart person. Yes, Mr. Einstein is the one that defined insanity in these terms. So if we're going to continue to approach peripheral neuropathy in the exact same ways and expect anything to change, that would be a true definition of insanity. Nothing's going to change. Now again, reminding you of the good news that I've shared in other video lessons, that the National Institute of Health says that as long as a nerve cell has not been killed, we can regenerate peripheral nerves. Excellent, excellent news. On the other side of that same news is the fact that if the nerve cell has died and this has progressed to a certain level, there truly is nothing we can do, and you truly are left with just living with it. Regenerating damaged nerves. What are some things that we can do? What are some steps that you can take that can be very effective? Well, first of all, seeking out proficient clinicians who focus on peripheral neuropathy. There are many very competent medical practitioners that aren't well versed in peripheral neuropathy, don't focus, and just don't know. So seeking out proficient clinicians is step one. Secondly, we can increase blood flow and stimulate nerves in order to get that regeneration. We need to mobilize the joints that are affected. We need to decrease inflammation with nutrition. We need to support the regeneration of those nerves with supplementation, and where possible, decrease or eliminate the underlying causes. We're going to spend a few minutes talking about each of these areas. Let's talk about proficient clinicians. Again, you got an introduction to us, our Synergy Spine and Nerve Center, in the first lesson, and our passion around this. And we, again, are very, very passionate about helping people decrease their suffering and improve their quality of life. And we have great solutions for doing that. We are a licensed neuropathy DR treatment center. And that's really important to understand. You see the picture of this individual here. This is Dr. John Hayes. He is the founder of Neuropathy DR, and he has done work in neuropathy for many years, over a decade, and very, very a pioneer in helping people reduce their symptoms and reduce or eliminate the progression of neuropathy. And so we work very closely with Dr. John Hayes. You can go to his Neuropathy DR website and get great information, research, solutions, all kinds of things from him. And we are one of his licensed treatment centers. Very important to know. So the real message here is that we have spent the time and become proficient clinicians where we can really focus in on neuropathy and providing solutions that really do work. That's why in that first video lesson, we're able to make the statements that 60 to 100%, we see 60 to 100% improvements in the patients that we treat. And so one of the things to think about in terms of this, and I'll use an example, you could go buy a scalpel off of Amazon for probably $15, $20. Would any of us have the tenacity or even the thought to go use that scalpel to do self-surgery? Most of us would not, because we just don't have the skill in order to use that scalpel correctly. It's the clinician, the surgeon, who really knows how to use that scalpel to be proficient in helping resolve your problems. Well, that's no different here. You want to seek out proficient clinicians who really are skilled, who really understand, know how to use the tools very, very well. When we talk about medicine, DIY, do it yourself, usually is not a very good approach. Now, we talked about increasing blood flow and stimulating nerves. Well, how can we do that? Well, there are lots of modalities and treatments that we can use, protocols that we can use to do just that. We can use electrical stimulation, which in our center, we have a few different options in using electrical stimulation for help treating neuropathy with great success. We can use low-level lasers in order to treat neuropathy with great success. And we find that we can use daily movement, which helps increase blood flow and stimulates the nerves in order to treat neuropathy with great success. So there's a lot of detail in how these things work, which ones are appropriate. We don't use all these treatments on everybody. It really depends on what's causing your neuropathy, to what extent do you have neuropathy. And so there's a diagnosis that's in order, that's needed in order to determine what's the best approach in terms of these tools. But with, again, our clinical expertise, we can determine which of these tools would be most applicable to your situation. And again, we see great success in using these for treating neuropathy patients. We also see that we need to mobilize joints. And there's a couple of different areas of mobilization in joints that we need to approach here. One is, again, every single nerve comes out of the spine. So if we've got issues going on in the spine, we need to make sure that the spinal joints are mobile and moving freely so they're not creating impingements on nerves that may be creating problems in the peripheral nerves further down the line. And so manual mobilization of the spinal joints is very, very important in successful treatment. Secondly, daily exercise to keep the spinal joints mobile. So we do use specific exercises on a daily basis to help spinal joints remain mobile and moving and functioning freely. We also use daily mobility of the joints that are affected, not just in the spine, but other joints, hip joints, knee joints, ankle joints, other areas of the body that may be suffering from immobility and creating or contributing to the neuropathic problems. And so using daily mobility movements and exercises is very effective. And other modalities as well, providing massage, acupuncture, stretching, all these things can help. In our center, we do provide massage. We do not provide acupuncture. We do provide some stretching things that you can do. But again, just the message here is that these things can help keep joints mobile and therefore be a great piece of the puzzle in treating neuropathy. We also need to decrease inflammation in the body. Many of you know that we have inflammation throughout our entire body. The number one contributor to how much inflammation we have in our body is what we eat. Nerves are very, very impacted by inflammation. So we need to take very serious measures in decreasing that inflammation. And what we find is that nutrition is a very powerful piece of the puzzle in helping neuropathy symptoms improve and decreasing or stopping the progression of neuropathy. And so part of our approach is approaching nutrition in a very, very strong way so that that becomes a very important piece. As well as supporting the regeneration of nerves through supplementation. And all the research that is out there, there are very specific supplements that can help neuropathy, can help inflammation. And so we have a variety of supplements that can be very, very powerful and effective. And again, being a piece of the puzzle. And I keep mentioning piece of the puzzle because any one of these things may help neuropathy, but none of them in and of themselves are enough. You have to put all the pieces in the right places. And it's just like a real puzzle that until you put the right pieces in the right place, you never get a clear picture. You're never going to get the full thing, the full effect. And so we have to put the pieces in the right place, and supplementation can have a very powerful impact in that. Now, one of the last things we have to do, though, is we also have to take attempts and do all we can to decrease or eliminate the underlying causes. We talked about many of the causes of neuropathy, and there are many. I'm only going to list a few here. But for example, if diabetes is the thing that's causing or contributing, we've got to control diabetes. Otherwise, we're going to be limited in the results that we get. If toxins are part of the problem that's causing neuropathy, we got to do what we can to decrease or remove the toxins. If the spinal issues are what's causing or contributing, we have to address the spinal issues. Whatever it is that may be causing or contributing to your neuropathy, we have to do what is possible. And we may not be able to completely remove them. We may not be able to completely control those things, but we need to do all that we can to control or eliminate those underlying causes in order to get the best effect and the best results. So with that, this concludes this lesson series. And what is the next step that we would invite you to take? We would invite you to come visit us at Synergy Spine and Nerve Center. Now, it depends on a couple of ways how you would want to approach that. One of the first things that you should do is go visit our website, spineandnerve.com. There's lots of content, lots of information. You'll learn more about us. You'll learn more about the things that we can offer, the things that we can do. You can see testimonial videos of patients that have experienced the results that we can offer. But we'd invite you to come visit us. We are here to help. We are passionate about helping people decrease their pain and suffering and improve their quality of life. We believe everybody can take steps in order to take the next step in improving their health, and we would love to guide you down that path. So if we can help you in any way, please contact us and let us know how we can best help you. Thank you for watching this series of video lessons. I hope you found it very, very informative, and I hope you now feel empowered to truly act in changing your circumstances, whatever those may be. Have a great day, and we hope to meet you soon.